Good afternoon, everyone. It's 12:30 and it's hip time. Welcome. I'm so happy you were able to join. I'm hoping to share with you, and in the next 5 sessions, I'm hoping to share with you theoretical knowledge of what's important to know, how to understand yourself that will give you a different framework of how to do these movements. Why do we do these Feldenkrais lessons, what these Feldenkrais lessons can offer to us. And of course, we will do a full immersion in the class, in the lesson. I'm hoping to give you 10-minute practices that will be feasible during the time in between our sessions. So between today and next week, even if you are a very busy bee and cannot do the entire Feldenkrais lesson, you will have an assignment of up to 10 minutes to work with yourself. Let's take a look at theory. So why this course? Because hips are giving us a lot of trouble. One of the studies, the top one here, showed that for people over 60 years old, 14% of them reported significant hip pain on most days over the past 6 weeks. So hip pain is something that bothers us quite frequently. Statistics about surgery. Hip arthroscopy, when I started my physical therapy career 30 years ago, there was not much arthroscopy in the hip joint. Even 15 years ago, that procedure was not common. But right now, the arthroscopies in the with the report that we see here between 2006 and 2010, there was an increase of 600% in arthroscopic surgeries of the hip joints. Also the data about total hip replacement, that 300,000 total hip replacement each year. And this is data that is actually quite old. I would think that the numbers have increased. Hip troubles are not only for older population. We see hip difficulties throughout all of our years. Infants are born with dysplasia, with instability of the hip joints. For the young and middle age, we have injuries of the hip joint and what's called FAI, or femoral acetabular impingement, either due to overcoverage of the acetabulum over the ball of the femur, or undercoverage, as in dysplasia or instability. In the senior population, we see, of course, osteoarthritis and osteoporosis, and fractures that can occur at any time. Other conditions that trouble our hips or concern our hips: tendinopathy, tendinitis, bursitis, the IT bend syndrome on the outside thigh, that it gets involved with knee troubles and hip troubles, snapping hip, all sorts of myofascial pain syndromes, muscle spasm, trigger points, subcutaneous pain syndrome. And when it concerns the hip, we can also develop adhesive capsulitis, or most of us know about frozen shoulder, but we don't hear as much about frozen hips, but we can get the capsule with adhesions, creating very similar condition to the shoulder, frozen shoulder. So what is the hip joint? Hip joint is the connection between your femur, your thigh bone, and your pelvis. Let's take a look at another. We have this wonderful anatomy app, which is Complete Anatomy. This anatomy app I highly recommend for anybody who is interested in studying anatomy, in knowing more. I use it practically every day in my teachings, in my working with clients. And anatomy app is giving us fabulous insights into how we are organized. So here's the skeleton. Here's the skeleton. We can zoom in. And what is the hip joint? Very often there is a misconception. People put their hands on the pelvis, meaning somewhere here where my cursor is hovering. And this really is not a hip joint. This is not what hip is. Hip is connection between your femur, the thigh bone, the longest bone of the body, which ends with a ball called femoral head that sits inside the cup of your pelvis. So if we take a look at the pelvis without the femur, you can see this is acetabulum, meaning cup, where the ball sits. So this is our hip joint. And this Complete Anatomy Fabulous app, we can look around, we can take a journey, we can see the cartilage, we can zoom in. This is a cup of the joint. That's where the femur sits, the thigh. So hip joint is the connection between your thigh bone and your pelvis. Next question, where is your hip joint? So please stand up for a moment. As you're standing, take a moment to stand away from your computer and think a moment, where would you pinpoint your hip joint to be? So often people put their hands on the side of the thigh, side of the pelvis, maybe, as I said, even on the top of what's called pelvic crest, on the top of the pelvis, but that's not where our hip joints are. Hip joints are somewhere more central in the crease of your groin, where the pants, when your pants crease, when you bend your knee, where you move your thigh a little bit toward your chest, that crease that is being formed in your pants is where you would look for your hip joint. Go ahead and try to, with your index finger, right index finger, try to point on your body where your hip joint is. And don't worry, in the worst case scenario, you get lost and you don't know where it is, but just guess, place your hand, your right index finger in the place where you think your hip joint is, where you would look for it. And then do the same thing with the left one. Place your left hand in the hip and feel how close the two hands are, how close our hip joints are, your right to left. You may be quite surprised how close they are to each other. Shift your weight a little bit, right and left. Good, and then come back to sitting. I'll play you a little video of me lining up the skeletal leg with my body, with my pants, and you can see the ball of the femur is really close to my pubic bone. That femoral head is sitting very near the midline. It's not on the outside. So it's somewhere here. The hip joint, the crease of the pants, where we squat, when we bend, when we walk, is around this place. So often, we tend to think that hip joint is more on the outside, like on the outside of the buttock. But that's where that bump on the femur called greater trochanter is. That bump on the outside femur. So go ahead and stand up one more time. Stand up one more time. And put your hand on the outside, find that bump. When we lie on something hard, on the hard surface, very often we struggle because there is tendency for that compression of that bone to feel not so nice, not so pleasant. This is greater trochanter. That's not the hip joint, that place that I'm pointing here, where you're touching, where it's close to your skin. If you roll your foot a little bit out and in, you will feel that bump on the outside of your hip to move underneath your fingers. Can you feel it? Take a right leg like a log and turn it out and in, and you will feel that bump is moving underneath your hand. But this is not hip joint. Hip joint is somewhere more central. Hip joint will be somewhere where I'm pointing right now. Go ahead, begin to, while you have your fingers on the hip joint or the front of the hip joint, begin to make a movement of sitting down or squatting. And feel, are you articulate? Can you feel your fingers in the crease of your pants, the bending as you're starting to squat down or beginning to sit down? Back and forth, very gently. Lovely. Now go ahead to your chair and sit down and feel how you use your hip joints to sit down. How do you use your hip joints to sit down? What are the cardinal movements of the hip joint? What are the movements, the basic movements of our hip joint? Here, I'm using this wonderful source, the book of Dr. Donald Newman, Kinesiology of Musculoskeletal System, with beautiful pictures. And what we see here are your pelvis, femur, and the possibility of movements, one relatively to the other. In a moment, we will study it. We will pay attention what it feels like each movement. But right now, what I'd like to point out that the movement that the hip joint allows is happening in 3 dimensions: forward, back, as in swinging your leg in walking, like pendulum. This is called sagittal plane, forward or backward, or we call it flexion and extension of the hip joint. Your hip allows you to move your leg out to the side. This is the frontal plane, the picture on the right side, when you can do side steps. You could do side kicks. You can move your thigh relatively to your pelvis, or pelvis relatively to your thigh on from side to side perspective. Our hip joint, the bottom picture, also allows us to rotate, to turn the pelvis or to turn the leg. Now, this series of pictures show us movement of the thigh relatively to your pelvis. First movement, bending knee to chest or extending. Basic movements of walking, climbing stairs, high steps, running, sprinting, all sorts of movements like this require thigh to come toward your chest and then to move backward behind you. The values of normal ranges of motion, about 120 degrees of flexion and only 20 degrees of extension. So when we walk, the hip extension is not huge, but it's a central movement, essential movement for health of the joint. Second is side kicks. This is called hip abduction, thigh moving outward, or crossing leg over, hip adduction. And finally, rotations. We can pivot, pigeon toe, turning the foot inward relatively to the pelvis, or move the foot outward like Charlie Chaplin walking with the hip turned outward. Please stand up. Let's take a look at these movements, what they feel like to you. If you have difficulty with balance, I would suggest holding on to a chair or a kitchen table or something, piece of furniture that will give you stability. So you're standing and don't do anything that hurts. What we want is we want to discover what the movements feel like in a neutral way, not with any discomfort. So what we want is to discover what it feels like, what motion feels like, not what pain feels like. You already know what pain feels like. First movement, forward bending and backward bending. Move your right thigh. Don't have to do a high step, but move the thigh a little bit toward your chest or as if you were to make a step. And then swing your leg backward and swing the leg forward toward the high step and backward, only within the range that feels comfortable to you. So this is movement of flexion, where the femur, your thigh bone, is moving relatively to your pelvis. Do the same on the left side. Feel how light or how heavy the movement is on the left side. Your thigh comes toward your chest. The thigh moves backward. Wonderful. This movement is also something that we do when walking. Go ahead and walk in your room. Make a few steps and feel you swinging your right leg forward, then your leg lands, then you are standing on it, and then you pushing off when the foot is behind you, meaning hip is in extension. So walk a little bit around the room and observe these movements of flexing and extending. If you have very tight quarters, don't walk around, but walk in place. That will do too. Second movement, come back to the screen and you remain standing, and we'll do the swinging of the leg outward and inward. Hold on to the desk or chair and move side kick, the thigh out to the side, and then back inward across. And feel what that feels like on the right and left sides. Don't rush. Can you discover the movement where the movement is small? You don't have to do big side kicks. Feel it. You're in your hip joint, in that crease of the joint. How you're moving out, moving in, moving out, and moving in. Do the same on the other side. Compare. Wonderful. These movements we use when we sidestepping, when you're getting out of bed and you have to swing your leg off the edge of the bed. When you cross your legs, which will be the first step of today's session, is avoid crossing legs. Crossing legs immobilizes, stiffens your hip. Yes, we have habits to cross it. If we cross it from time to time, and if we don't fall into crossing only the same way, it wouldn't be as terrible. But most of us will find a specific leg crossing over majority of the time because that's our habit. Third movement, the bottom of our picture, rotation. While standing with your right leg long, turn your right foot outward and inward, the whole leg like a log rotating out and in. Do less, don't go far, don't go far. Learn to sense yourself with the most minute, smallest motion. Feel this is rotation where femur is moving relatively to your pelvis. Inward, in-toeing, pigeon-toeing, and out-toeing, in-toeing, out-toeing. Do it on the other side and feel what that feels like. Wonderful. So this for most people is no-brainer. Nothing so revolutionary here, nothing so interesting, basic movements. But let's take a look at the same movements, but from opposite point of view. Instead of your thigh moving, we'll be moving your pelvis relatively to your thigh. Flexion and extension of the pelvis around the thigh, or to be specific, acetabulum around your femoral head. The best will be to experience in sitting. So please come to sitting. Sit, and let's do the movement of flexion of the hip and extension by moving your pelvis, not your thigh. Your thighs are just sitting. Move your pelvis by leaning forward. Lean forward a little bit and lean backward. You could put your hands on the pelvis. Place your hands on the pelvis and rock yourself a little bit forward and backward. There are two ways to do it. One is through arching the back or rounding, or you could also keep your body like a plank and move your whole body toward like folding jackknife and opening, folding and opening. Feel, can you feel your right hip joint? Can you feel movement? This is not so as clear as moving the thigh up and down, but it's the same movement. Feel now your left hip as you're shifting your pelvis. Can you feel a difference between two hips? You might find like, aha, I'm rotating a little bit. My one hip is freer. And as I'm leaning forward, I'm actually starting to twist. My pelvis is twisting. Or some of you will feel I'm sitting deeper in one hip, like one hip goes backward more as I lean forward. I'm folding deeper. Beautiful. Second movement, the movement that is the same as swinging the leg out and in, let's do it in standing. Stand up. This time, you will be tilting your pelvis right and left around a column of your leg. Let's do it over the right leg first. You're standing on the right leg, both legs, but weight mostly on the right leg. And now dip your pelvis and your whole torso a little bit to the right, over the column of your right leg. How can you tilt yourself to the right? Lean to the right. Think of this. I'm standing like this and I'm dipping the whole body on that plane to the right. My pelvis is going to tilt over my column of your right leg. This is the same movement as if you did a side kick. Can you feel it in your right hip? Just do it to the right first. When you lean to the right, you're bringing your pelvis toward your thigh. If you're moving the thigh, you're moving the thigh toward your pelvis. But basically in the hip joint is the same movement. Many people with hip problems walk by waddling. Many people waddle. You see every time they step on the foot, there is a little bit dipping to the side. And this is a very intelligent, actually, way of the system, of your nervous system coping with degeneration, because it's unloading the hip that you're leaning toward. Good. Now, begin to drop the opposite pelvis, which will be the oppositional movement. In the previous movement where we were moving leg relatively to the pelvis, now you're moving the pelvis by dropping your left hip down. You're moving in the right hip joint. Can you feel that? Not so clear. You see, this is interesting. It's not so clear. Let's go back to our screen. The middle screen. Now go from dipping to the right and then dipping to the left. So your pelvis goes side to side. Go to the right, leaning whole body to the right, and then drop the left pelvis, leaning the body to the left a little bit. Sometimes people kind of sit in the hip joint. Dancers call it sitting in the hip joint, sashaying, swaying the pelvis. This is the form of moving the pelvis relatively to fixed hip. A lot of knee problems, hip problems begin because there is lack of stability and movements like this become a little excessive. Now do it on the left side. Give your right hip a little rest. Move your stand on the left leg and first dip to the left and feel your pelvis moving from side to side like a scale. It moves to the side. And then drop your right hip down, sagging a little bit. So one time you go to the left, one time you go to the right, and feel motion in your left hip joint. Motion in your left hip joint. One time when you lean to the left, it gets to the point where your right heel will lift off the floor. Maybe even your whole leg will lift because it basically gets shorter, right? It's you pulling the opposite side of the floor. And then you sag and your knee needs to bend on the side that you're sagging. Wonderful. Now walk around, limber up, loosen up, shake it off. We'll study what the third movement is, rotation, but not when the leg is moving, but when the pelvis is moving. And now we have our feet planted. Your feet are planted and begin to move your pelvis, turn it to the right. Pelvis to the right. And then return it. Feel rotation. Can you sense rotation in your hip joints? Let's go only to the right so we can study, we can slowly feel what happens with your right hip joint. Your right hip joint internally rotates. It's the same thing as if you were pigeon toeing on the right side. It's the very same movement. Go back to neutral. And then turn again your pelvis to the right and feel your right hip joint. It turns in. Come back. It's the same movement as hold the pelvis still and turn your right foot in. Pivot pigeon toe. Turn your right foot in. Feel it's, no, don't turn the pelvis. Don't turn the pelvis. Keep the pelvis still and turn the foot in. Turn the right foot in. And this is the same movement, whether you move the foot, leg, or whether you're moving the pelvis above. Now, let's go back to keeping the foot planted and turn to the right. Feel in the left hip joint, keep turning your pelvis to the right and back, to the right and back, and feel your left hip joint now is externally rotating, as if you were doing Charlie Chaplin. Your pelvis on the left side is moving forward. The foot, left foot, remains planted. That requires outward turning in the hip joint. Good. Let's do it to the opposite side. Let's turn to the opposite side. Turn your pelvis to the left, as if you were looking to the left. Somebody called your name and you look to the left. Can you feel your left hip joint is requiring to turn internally, as with pigeon toeing? Sometimes people have difficulty turning their head, neck troubles, because their hip joint is not permitting the movement and they're straining so much their neck. Feel as you're turning left, could you feel left hip joint internally rotating and right hip joint externally rotating? A useful tip for golfers who love their game of golfing and they need to twist and they need to do what you're doing right now, but they feel pain in the hip joint. If the joint that you are swinging toward is giving you a problem, turn your foot a tiny bit out, meaning start from a stance when your hip is slightly externally rotated. You'll be able to swing the golf club and whole trunk without pinching, without going to internal rotation, because for many people that internal rotation is blocked. The joint is degenerated and inflamed, and therefore you need to open your stance a little bit. Great, walk around, please. This is the end of the theory section for our first meeting. The next is the full awareness through movement lesson, pelvic clock, new perspectives.